The murmur of aortic stenosis is a harsh, diamond-shaped murmur as shown by this phonocardiogram. Listen to a patient with aortic stenosis. I will begin with 3 normal beats and then add the murmur. This murmur is heard best at the second right intercostal space with the diaphragm of the stethoscope. The severity of the stenosis is related to the delay in the peaking of this murmur. The later the murmur peaks, the more severe the stenosis. Aortic stenosis is often associated with a delayed and diminished carotid pulse. Notice the normal carotid upstroke on the left and the delayed one on the right. In many adult patients, aortic stenosis occurs in the setting of a congenital bicuspid aortic valve. Once the valve calcifies, the second heart sound may become inaudible. In some patients, the murmur of aortic stenosis may be heard at the cardiac apex with a higher pitch. This phenomenon was first described by Gala-Vardan. This murmur is heard best with the patient sitting up and leaning forward. Echo Doppler studies can directly measure the gradient across the aortic valve, allowing a calculation of aortic valve area. In summary, aortic stenosis presents with a harsh, diamond-shaped, late-peaking murmur heard best at the second right intercostal space with the patient leaning forward. Listen once again to a patient with aortic stenosis. The murmur of aortic regurgitation is a high-pitched diastolic murmur that begins immediately after the second heart sound, as shown in the phonocardiogram. This murmur is usually heard in the third or fourth left intercostal space with the patient leaning forward. The length of this murmur is directly related to the regurgitant volume in most patients. Typically, a pulse pressure greater than 100 millimeters of mercury accompanies severe aortic regurgitation. The murmur of aortic regurgitation is heard best with the diaphragm pressed firmly against the chest wall. This murmur can be increased by having the patient tighten both fists. Listen to the change in the murmur of aortic regurgitation with a hand grip maneuver. Rest. Hand grip. If this murmur is heard at the lower right of the sternum, then aortic root pathology such as an aortic aneurysm should be suspected. Echo Doppler studies can show the severity of aortic regurgitation. Notice how this color jet coincides with the onset of the murmur. This figure shows the direction of regurgitant flow in this disease. In summary, the murmur of aortic regurgitation is a diastolic, decrescendo murmur which is high-pitched in character and heard best in the third or fourth left intercostal space.